We transported a 2-year-old female penguin to Iowa Radiology for further diagnostic imaging. So she's had a case for about a year that we've been working up and treating that hasn't really been successful in some of our treatments or modalities, and so we finally decided that further diagnostic imaging was warranted to help us kind of better identify a cause and potentially further treatment.
We got a call that there was a penguin who needed an MRI of their foot, and we said, well, we've never done it before, but we'll give it a shot.
We set up a team as far as the zoo staff to do the anesthesia, and that went very well. We were very happy with that. And then Iowa Radiology was fantastic. I think they had a group of people that were, one, interested in the case. It was kind of an interesting case for them, but also set us up for success as well.
The penguin did great. There was a huge team involved. It was a big team effort, obviously, but I think the images turned out well, and I think speaking with the veterinarians, we got some good answers for them as they try to develop their treatment strategy.
Yeah, so we just have a little bit of preliminary data at this point. So another thing that Iowa Radiology did really well is they helped us read out some of these MRIs, although we will send them along to a veterinary radiologist as well for further interpretation. But primarily we found that some of the tissue swelling that we've seen within that is more fibrous tissue rather than fluid, which is what we suspected. Getting that final report that outlines exactly what the images show is going to be step one. And then if surgery is indicated based on that, that would be the next step, is going in and trying to remove some of that tissue that may be causing the continued inflammation that we're seeing that hasn't really been responsive to antibiotics or anti-inflammatories. And so if indicated, yeah, surgery would be the next step that we would try to proceed with.
It's been a lot of fun working with the zoo. Everybody loves animals. I mean, we're passionate about patient care, but we have a lot of people here who love animals too. And I think the fun thing is you can see how technology really impacts care of patients and animals alike, and I think that makes everybody feel good.
Working with Iowa Radiology has been fantastic. They've been a huge supporter in the zoo, especially in the last year, both financially and with diagnostic imaging. So one of the cool things they did earlier this year was support us financially in order to purchase a new digital radiograph equipment. And that has been a huge life changer here. Every animal that gets seen gets baseline radiographs, and so we use that machine quite often. So their support specifically in that, but then in really helping us excel our medicine here by, when we do run into cases where we do need some advanced imaging, their support to be able to help us provide that for some of our animals has been fantastic. And this relationship is something that I'm really looking forward to, not only now, but in the future too, so that we can provide better care for these animals through their help and their assistance.
We're certainly here in the future if other needs arise for other animals. So.